Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all of you on today's case study discussion on a very important topic. Before starting this webinar, let me tell you the topic for this webinar. The topic for today's live discussion is that is mastering the maze, expert approaches to managing difficult autism cases. And for this, we have very eminent guest, the speaker for this session, who is going to discuss a case study on this topic. As we know that autism is a very common problem, but the attention, the things which need to be focused are very less, and awareness is very less among the people. So for that only we have came with an case study, and let me introduce our guest for today's. First, I would like to introduce, with all respect, Mrs. Neha Tamboli, ma'am, and let me share some of the achievement of ma'am. Ma'am has done MSc in microbiology and Bachelor of Medical Technology (BM Tech) and postgraduate in Diploma Psychology Counseling PC and postgraduate diploma in Children and Adolescent Enhancing Potential and experience in Chiranjeev Child Development Research Institute and director since last 29 years and done more than 850 aptitude testing and career counseling since 12 years. Working as adolescent counselor since 2006, more than 1,500 counseling sessions conducted. Working as administrator in NABH Aggregated Institute and Hospital since 2019 and earned NABH aggregation two times successfully. And she is honored with Idol Lady Ahmednagar prize given on 9th May 2029, and she has done publication 200 articles in various newspapers and conducted Akashvani and television programs on various aspects development and adolescence program. And she has also having social experience arranging many camps for children and emotion intelligence, mental development, and study skill given free services for handicapped children. Ma'am, with due respect, I welcome you, and you have done a great work in the society, ma'am. It really means a lot. Like lots of people come and serve for the nation, for the society, for the betterment of the children. If the children are productive, so and the nation is also they are the future of the country, right, ma'am? And I welcome with all respect on today's session. And moving forward, we have an eminent guest. Everyone knows him. He is none other than Dr. Suchit Tamboli, sir. He has done PhD in Pediatrics Development Pediatrics, FIEP Fellowship of Indian Academy of Pediatrics, and he has done MBBS, DCH, PGDAM, PG, DMLS, and practicing pediatrician Maharashtra to be honored PhD Pediatrics from MUHS and awarded as India's top most 25 pediatrician, most promising doctor in development and adolescent pediatrics in India. Associate editor, next test book of growth development and behavior pediatrics 2024, National Executive Board National Executive Board member of Central AIP 27-2029, faculty in international and national state conferences since 1999, more than 350 lectures, director NABH Pre-Aggregated Hospital, OPD and Child Development Center since 2019, and National Coordinator IAP Action Plan Basics of Behavior Module 2029-2022 20, National Conveyor and Coordinator Development for All Grade to Crayons Early Interventions, and 2026 to 2029 National Conveyor of IAP की बात कम्युनिटी के साथ बिहेवियर प्रॉब्लम्स, चेयरपर्सन ऑफ गवर्नमेंट ऑफ महाराष्ट्र डिसेबिलिटी सर्टिफिकेशन कमेटी 2025 and ex national chairperson of IAP GDBP chapter 2020-14-2015, secretary of NCDPA 2024-2025, and organizing committee member of World Pediatrics Congress Singapore 2023, and published more than 15 paper indexed in journal article, four books, YouTube channel. Dr. Samjit Ali has more than 42 videos, and his hobbies is to reading, singing, and acting. Sir, it's a great pleasure to welcome you also. Like from being from taking care of the patients, also you have took time for this webinar. It shows that how much you are active in sharing knowledge. I welcome both of you on today's webinar with great honor. Now I would like to hand over to both of you to your presentation. Thank you so much, sir.
Thank you, Faraz, for the nice introduction. And I'm grateful for IJCP for this today's webinar, because this is today is very important topic. Can you see the slides, Faraz?
Yes, sir, I have put. You can make it full screen and run the slides.
Okay. So actually, what we are going to conduct is today practical management of difficult autism cases, which we came across since last 2 3 years. Because autism is very difficult to manage in some cases, and how we had managed that cases, we are going to discuss that. So today actually is Autism Day, and the theme of today's Autism Day is empowering autistic voices. And the actually most important thing is that they are different but not less. That is the message we want to give to everybody. So we'll start this lecture with Neha madam.
So, why we are going to discuss autism today? Because it is very unique in nature. Because an apparently normal looking child with so many abilities and skills is not functioning in a social setting. That is the most important point. When assessed on a developmental scale, they show total lack of uniformity in different areas of development. These children have to be diagnosed on the basis of clinical suspicion and assessed by using the autism specific scales. So, what is autism? It is a developmental disorder characterized by qualitative impairment in reciprocal social interactions and social communication, restrictive, repetitive, and stereotype pattern of behavior, interest, and activities. May have unusual responses to sensory experiences or perceptions. The 1% of world population, that is 1 in 69 children in India, they are having the autism. The prevalence has doubled in last decade. Recent estimates of the prevalence of ASDS in US are in the range of 6.5 to 6.6% in 1,000. More boys than girls are constantly found to be affected with ASDS, with male to female ratios ranging from 2 is to 1 to 6.5 is to 1. Common age of presentation is 1.5 to 3 years. What is etiopathogenesis of this? We do not know what causes it. Current research indicates that anything that can produce structural or functional damage to the central nervous system can also produce the condition of autism. The certain viruses or some known genetic conditions are there. Families that have more than one children with autism can show the signs of this autism. About 10% of all cases can be accounted for genetically transmitted. It may be caused by different factors. The cause is never known. Autism is not caused by an unhappy home environment, both the parents working, mental stress during the pregnancy, poor handling by the mother, and emotional trauma or other psychological factors. You cannot cause a
So
child.
this is very important point, because autism parents are usually worried
Yeah.
about this problem, that whether our unhappy home environment has
Mm.
done this, or we were fighting with each other, there was mental stress during pregnancy. All these factors are not at all important. You cannot induce autism, or you cannot cause a child to become
Become
autistic. That
autistic.
is the important message we want to give.
Yeah.
So now we'll discuss few cases.
So there is one case. Rahul is a 2-year-old boy. His parents had previously brought him to the clinic for immunization. They are now concerned because he's not talking. He was born to healthy parents after a normal pregnancy and delivery. His physical growth and motor skills have been age appropriate. So he makes very less eye contact and seems less interested in interacting with the family and friends. He is not interested in playing with the friends and games. He loves watching videos, particularly one cassette, which he insists on watching for the several times in a day. He has several tantrums, particularly if his daily routine is altered in some of the other way. His physical examination is completely normal. So, how to approach with this case? First, we have to take the detailed history of the child and parents. We have to use MChat. We have to find the DQ and screen for the different areas of development. what are the is the any other developmental aspect is hampering. We have to use DSM 5 criteria and Indian autism scale to rule out the autism. Then we have to use the language evaluation screening test.
So here
To,
we have to remember that areas of development means there are six areas of development. That is uh, gross motor development, fine motor development, mental development, social development, then expressive language and receptive
yes.
language. And all these six areas we have to assess the child and then actually guide the parents accordingly.
Then Ali is a the mother is Ali's mother is saying my son is 3 years old. He is very hyperactive. He can talk but won't reply to my questions. He only listens to me when he is in a mood. My daughter was more matured at this age. His father and uncle both talked late. Should I be worried? My friend's son has improved a lot after the speech therapy. Should I see a speech therapist? Will he teach my child to talk?
Here we have to remember that speech therapist is not a solution. So you have to show the child to developmental pediatrician and then take his advice. So because developmental pediatrician is master of orchestra and he has to guide them according to the abilities of the child by developmental testing.
So first we have to do the DQ, then ADHD. We have to diagnose the ADHD scoring, Autism Indian scale, DSM-5 criteria for autism, LEST test, and there is no magic treatment or very fast recovery or very fast prevention of this autism. We have to take the stimulation programs, occupational therapies, speech therapy, and along with the medicinal therapy.
So here, most important point to remember is that medicine are required for hyperactiveness or ADHD part. But ADHD we cannot diagnose before 4 years of age. So we have to give them criteria according to the American Association of Pediatrics, and with that now they have actually previously it was 7 years. Now they have reduced it to 4 years. So we have to diagnose them properly and then Indian scale according to Indian scale also we have to diagnose them and then give treatment which is very important and long term, like stimulation programs according to the mental age of the child or developmental age of the child, then occupational therapy, speech therapy and medicine wherever required.
This Dhruva is 3 years old. He is very hyperactive. Last 6 months, he has started going to the play school. He just wouldn't sit in the classroom. We went to see a psychologist at the request of the school. At the request of the school, after assessing Dhruva, she said he has autism. What does this mean? She says he needs therapy. What does that involve? Will he become normal child? She also asked us to see another doctor who would give him medicines to control his hyperactivity. Is it safe? Will it harm his brain?
So that is the worry about their child in parents always.
So we have to again do the developmental question, ADHD, Autism Indian scale. We have to use DSM-5 for autism scoring, LEST test for language, and we have to take the stimulation programs, occupational therapy, along with the speech therapy and
And
medicine.
here stimulation programs, what we are giving is Trivandrum Bal Vikas program, which is done by Dr. M.K. Nair from 0 to 6 years. And what Neha Madam is daily giving is that portage education. So Indian National Portage Association. So both programs are, they are standardized program and they consider mother as a therapist. So suppose दो शब्दों का वाक्य बनाना, आपने क्या करना है, एक दो तीन चार, और सहायक खेल सामग्री. So like that we have to give them proper guidance how to stimulate that child in every area, and in every area maybe 100 to 110 items are there, and we have to give according to their mental age. So then Nachiket, he has stereotype repetitive motor mannerism and seeks to feel people's clothes. Actually, here Nachiket does use eye gaze, but his facial expression and gesture, but in an infrequent initiator of communication. He shows some appropriate response to other people's emotion, but also often shows an odd response. He is unconcerned about modulating behavior according to the social context, and he has some fixed routine.
So here, this Advait, he was a 6 years old child with a low IQ, severe autism, and with a rocking movements, with a severe ADHD, and he had no toilet training. He was non-cooperative. He was not cooperative at all with the parents, with the therapist, and to the psychologist. Didn't respond to anything, not non-attentive, and didn't mix with other children.
Here we have to remember that category of autistic feature is important. So whether the child is mild autistic or moderate autistic or severe autistic, or child is having what is the criteria category of IQ, that is also very important.
So in the management, the medicines were used. Daily OT was required, and deep pressure methods, rolling the ball with the deep pressure on the backs, was the main OT given. Then speech therapy was given, stimulation programs, half knee activities were given, toilet training to the parents and to the child given for bedwetting. Pica was also the problem. Improving receptive language. For improving the receptive language, his mother had was given the home plan, and with that she taught him many of the um, activities for the name of the objects, just like the name of the fruits. She classified name of the fruits, name of the flowers, like that. The classification of the uh, objects were done, and it was very helpful for him. Simple games were given to improve the concentration. Simple punishments were suggested to the parents. No physical punishments were suggested, and uh, reward system was also used. The simple small rewards were suggested for the better work or better improvements. Patting and good words, as well as the simple home plans, and speaking
National level
more, speaking with the child. It was suggested to the parents. So the improvements were the eye contact improved in 1 month, his attention improved in 4 months, body rocking movement stopped within 8 months, toilet training was perfect in 10 months, and he could play with the friends, and he could communicate. His receptive language was also improved within 1 year.
So actually, this is Sriya, who was 5 years, female with no eye contact, not responding to command, delayed in speech, swaying, rocking, does not understand, and flapping, attention problem, babble speech. So how we manage? Because we then concentrate on every point, that eye contact and attention, where we use flashcards, music, water balloons, make funny faces and funny noises to make sound. Then board activity like sitting and standing for 8 minutes, massage, different types of touch, ball movements, forward and backward, pin fixing activity like ball bouncing, different shapes, kneeling activity. So then palm massage, blanket wrapping, then eye hand coordination, dark room therapy, sensory mats, then oral massage, jaw vibration, busy hand activity, and home plans. So after doing all these management activities, there was improvement of eye contact within 3 months. Attention was improved in 5 months. Hand flapping in 5 months. Understanding shape in 9 months. Then she starts talking words at 9 months and starts singing in 1 year. which was very important. So what are the principles of management? That is very important. So in case of ASD, similar to other neurodevelopmental disabilities, needs supportive and continuing management, and medication have not proven to correct the core deficit of ASD. So actually, what is important is that we do not have any core deficit correction medicine. So core deficit is not corrected, but the problems which are there, like hyperactivity or depression or anxiety, they can be definitely managed. So the primary goal of treatment is to maximize the child's functional independence, that is actually activities of daily living, and improve quality of life. So facilitating development and learning, promoting socialization, reducing maladaptive behavior, educating and supporting families is very important. So what are the recommended modes of management? Behavior and communication based approach. This has to be coupled with parental training and family support. Occupational therapy, sensory integration therapy, which will help you to manage activities of daily living and sensory issues. Speech and language therapy to improve the communication. So medical management include all immunization should be given. There was misconcept that MMR causes autism, but now it has been proved beyond doubt that it doesn't cause autism. So all immunization can be given. Treatment of acute illness, management of sleep dysfunction, then management of medical problems which are very common with autism, that either seizure disorder or GI disturbances or constipation. So we have to treat that medically. Treatment actually coexisting challenging behavior or psychiatric conditions. So then the another complicated case, Krishna.
Krishna had a borderline IQ. He had many behavioral problems, no eye contact, hyperactivity, didn't mix with other children. He had a self-talk, repetitive sentences, hand clapping. He couldn't write, grip was not proper, and less communication was there. So in the treatment, forward and backward rolling, pin fixing, ring activities, eye-hand coordination activities, board activities, sitting and standing were given. Different touches, kneeling activity, different shapes, smells were given. Then grip experiences to improve the grips, and oppositional exercises, flexion exercises were given. When he repeated sentences, he was punished. Writing and reading was taught. Linear bar walking, midline crossline activities were given. Body parts identification, group sessions were taken in the play therapies, and palm massage was given. So his eye contact and attention span increased within 2 months, started listening in 4 months, self talk was reduced in 5 months, hand clapping in 5 months, 8 to 9 months of treatment. He started writing and identifying the words. He started mixing with children in 12 to 13 months. Now he can write 1 to 100, sing songs, can write A to Z of his own, appreciated by teacher. At last, at last 1 to 1 point, in last 1 to 1.5 years, he is now has improved a lot.
So actually, this was miracle for the parents, because now that child is going to school, writing A to Z, can write 1 to 100, and teachers also appreciated that. So that 1.5 years, whatever the treatment was given, and the मेहनत जो उन्होंने की, तो वो मेहनत का अभी फल मिल रहा है, and they were very happy. So treatment, actually what is important is that to actually we have to know the what are the goals. So minimize core feature and associated deficit, then maximize functional independence, and elevate family stress, which is very important, because we have to counsel them and make them prepare to give proper treatment. So educational intervention is again important. Developmental therapies like communication or sensory fine motor, gross motor, then behaviorally based treatment, medical or biological treatment, support family in home and community. Then in behavioral intervention, there are methods like applied behavior analysis, which we are trained in that, and in our center we are giving this therapy. which gives very good results in their minimizing their behavioral problems. So generalized behavioral teaching approach involves the reinforcement and consequences to shape behavior. So all of our parents used it. Involves actually ABC is not airway breathing circulation, but it is a antecedent behavior and consequences. Then speech and language therapy, where behavior based it is behavioral based therapy, intensive actually structured teaching is there. Then augmentative strategies are there, like sign language or PECS or aided augmentative or alternative system, decrease non-communicative language, and developmental pragmatic approach. So all these are important by social skill training. Then psychopharmacology, where we have to treat the target symptoms like stereotyping, withdrawal, obsession, or hyperactivity, attention, increase attention span, aggression, sleep. So we have to give some medicine for that also. Then mind body medicine, yoga, music therapy does help, and energy medicine or biological based medicine are also given, which may be required, like uh, immunization related or immune therapy, or wherever they require antifungal or this thing, steroid. But stem cell transplantation has no role at present. So there is no role of stem cell in autism management. Then gluten-free diet. Here it is very important. This gluten-free or casein-free diet, the actually the diet which is prepared by Nilofer Institute of Hyderabad has given many choices that what is to be given and what is to be avoided. So here important is that if you can follow this diet, we have got very good results in case of children who follow this diet. They definitely had improvement in their or reducing hyperactivity. So multiple reasons for multiple therapies.
Uh, no one therapy solution is proved completely effective because autism affects multiple areas like communication, sensory behaviors, and activities of daily living. Combination therapies give better results. Most common therapies suggested are ABA, Applied Behavior Analysis, Spatial Education, Sensory Integration Therapy, plus OT, Speech and Language Therapy. So, what is the duration and frequency of therapies that is customized for each child? Age, speech, cognitive level, and behavior is very important factors. To start as we have to start as early as possible. That gives the best results. Home training whenever required, we have to take. Remember, OT is not answer for all of this, not the complete remedy. Combination approach is very important, and the therapy should be feasible, economical, and relevant. So, how to continue the therapy or where to stop? So, the parents need guidance for that. Nature of the therapy changes with age. Play therapy, behavioral therapy, and social skills are the integral part of the program. Therapies need to be integrated with the learning program. Lifelong support is needed for the complete remedy. And these children should be should we should life skills are very much important for these children in for older children and adolescents. Life skill training starts with the daily activity learning and then moves up to socialization, social manners, caring for self in social settings, awareness of public and private, good touch, bad touch, that is very important, and gender appropriate behaviors. Life skills training is mostly at home, in schools, and in various social settings. Life skill training is parent mediated and hence requires training of the parents first. Inclusive schooling and teacher training is very helpful. So, for that, we should know the child's strengths and interests. So, known to have specific strengths and interests, it is better to know for the parents and teachers. They should know the specific interest. Are they positive or negative? If they are positive, then give the constructive direction for the strengths. It can be developed into vocation. It is if is it a barrier for overall development, we have to see for that. And special coach and coaches are they are available and they are required
So
to
we have
increase.
seen that these children can become a good swimmer, and they have done a lot in
Mm.
national level as well as international level.
Even
So
they are very nice musicians,
yes,
and they are very nice athletes also, and they are good in arts also.
so that's why strength
Yeah,
and interest we have to assess,
assess
and that
them
is very
for.
important. So role of parents in the therapy is very, very important. So always I say that mother is considered as a therapist of the child, but nowadays father are also involved and they also take very good interest. So both are important. So role of parents means early intervention, individualized support, daily life skills. So challenges which are faced by the parents can be taken into consideration, and empowering the parents to requisite knowledge is very important. So promoting emotional well-being of the parents as well as shaping future advocates is very important for them. So
So, how to identify the behavioral problems? How to list them? So, we have to see first, which is the very harmful behavior for other people. First, we have to see for that, and we have to treat it, and then change the frequent behavior. What he is doing the frequently and which is unsocial behavior, we have to treat that. Then we have to target the behavior for the management. Then we can have the reward system, and we can identify that behavior, and uh, we have to see the different assets of the child. What are the positive things? We have to find out that, and we have to enlighten them. Then baseline assessments, in that why the behavior is occurring, when it is occurring, and is it occurring with some person or some specific a specific time. We have to see it and study that, and we have to study the consequences of that behavior. We have to give some punishments, or sometimes non-punishment techniques are also useful in changing the behavior. So we have to make the behavioral management programs and keep the follow-ups of the behavior. Then what are the different educational approaches? That is the treatment and education of autistic and related communication handicapped children. It is used as a structured teaching approach, that is a special education program. The principle of structured teaching include developing an individualized, person-centered and family-centered curriculum for each student, structuring the physical environment using visual support to make the sequence of daily activities predictable and understandable. So, to make the individual task focus on teaching independent skills in children who lead up to independent work skills for future employment. Characteristic pattern of thinking and behavior, that is very important point. Fulfillment of fundamentally human needs such as dignity, engagement in productive and personally meaningful activities, and feeling of security, efficacy, and confidence. That is the very important factor. Meaningful behavior is rewarded and unwanted behavior is ignored. That teaches skills at the table using the discrete trial training drills. Skills that are mastered in tabletop drills are then practiced around the house and school in more natural settings.
so here most important is that meaningful behavior is rewarded, but unwanted behavior is ignored.
Ignored.
So you have to ignore and don't comment on their unwanted behavior, so that they will feel that due to that behavior they are not getting attention, and that's why that behavior goes on down level and will be demolished. So educational approach, actually applied behavior analysis is very important. So typical ABA programs are intensive 40 hours a week program that often recruit parents, teachers, friends, and volunteers to practice skills in wide range of setting to help build important skill and reduce difficult behavior in individual with the autism. So actually alternative education approach are very important. So we have to first finalize the range of option like inclusive schooling, special school, homeschooling, or unschooling, depend upon the parents' attitude and resources. And as the age advances, shift from one type of education to another is needed. And long-term goals are very important. So independent living, well adjusted in society, communication skill, appropriate for the level, vocational skill, making the child useful for the society, happy child and happy family. So our goal should be to make that child independent. That is very important. Rather than the goal is having he should score 80% marks or 90% marks is not our goal. He is going to English medium school or vernacular language. That is not our goal. That depends upon the actually what are the abilities of the child. So according to that, the guidance will be given by the psychologist as well as pediatrician. So support system is very important. So support is required everywhere. School will require shadow teacher, home, trained house help, then transport, trained people aware of meltdown in autism, technology of communication, technology for the safety, and medicine. There is no pure medicine, so challenging behavior may require medicinal support, and FDA USA has recommended only two medicines, risperidone and aripiprazole. So both drugs require supervision. Brain tonics, actually there is no role of brain tonics, but we can give omega 3 or L-carnosine, and gut brain axis probiotics in selected cases, and GFCF diet, which I was referring by the Nilofer Institute Hyderabad, is a good alternative for the medicinal part. So drug summary useful for associated illness is very important. So we have to manage them by hyperactivity, attention, as well as ADHD part, and aggression and self-injurious behavior. So for that, either stimulants or atomoxetine and anticonvulsants, wherever required, we have to give this medicine. And what are their possible adverse side effect and drugs which are useful, we have given in this chart. We will not go into the details of this chart, but most important part apart from medicine is vocational guidance. So rehabilitation is important. So as early as possible, skill-based training program only focus on academics, not useful. That is very important. That you should not focus on academics, but try to make him independent. Self-help, life skill, basic academics, and health and hygiene or sex education. And this is for the adolescent age group children. So, what is the ideal approach? Team effort of the parents, teachers, doctors, therapies, medication, behavior modification, regular monitoring. So, prognosis depends upon the severity of ASD symptom, pattern of onset and clinical course, cognitive abilities, associated conditions, and importance of early diagnosis and need for the sustained support. So, now last 2 3 slides we are going to see role of AI, because nowadays AI is a keyword. So wherever we go, we heard about AI. So AI in autism spectrum disorder and screening and diagnosis is very important. So diagnosis, AI is revolutionizing ASD diagnosis by enabling objective, efficient, and data-driven screening through the machine learning and behavioral pattern analysis. So that is very important. So traditional screening methods like MCHAT, ADOS rely on clinical observation, which can be subjective, time consuming, and expertise dependent. But AI is a complex neurological condition where for ASD, which is a complex neurological condition, and it is diagnosed by AI. What are the key applications? ASD detection, behavioral data analysis, AI process, facial expression and eye tracking, AI enhanced software, and all these slides are given by Dr. Samir Shah from Baroda, and he really has done a lot of work in that. And key AI applications in ASD detection like speech and voice pattern recognition or motor movement and gesture analysis is important. So, what are the advantages of AI? Improved accuracy and early detection, reduced physician workload, better access to healthcare, budget friendly pediatric care, and enhanced medical education. So, challenges: data privacy and security, algorithm bias and inequality, parental and physician trust in AI, legal and ethical implications, and over reliance and on AI. So, the future of AI in pediatric healthcare is AI breakthrough in pediatrics, including actually wearable gadgets or continuous health monitoring, show promise for the future, and using predictive analytics to avoid pediatric disease. And as AI evolves, condition coordination among the physician, data scientist, and politician will be critical to ensuring responsible and ethical care use. So, conclusion: AI is improving diagnosis, treatment, and accessibility. It cannot replace human pediatrician for increasing productivity, accuracy, and patient outcome. But it is a ethical. There are ethical concerns guaranteeing data security and increasing AI knowledge. So actually, AI has potential to improve this healthcare and potential to revolutionize the diagnosis as well as management part, and that is very important. I think we have exceeded the time, but the important part was there. That's why I actually gone through these slides. So I would like to answer the questions if you have anything, any. Thank you very much. Hello, hello.
So much, sir, taking out your important time, and ma'am also for taking into this topic
Yeah.
about more details. And can you hear me?
Yes, yes.
Hello.
I can hear
Yes,
you.
sir. Thank you so much, sir, for taking out your important time.
Can you close the screen of slides?
Can we take these
Okay.
questions one by one, sir? We have received some
Yes,
questions.
yes, definitely. You can you can
Yeah, the
ask.
first Yeah, for the first question is for ma'am. Like ma'am, you have been in that field for more than 10 years. Like you have lots of experience. You have gone through lots of social work too, ma'am. Like first question arises like autism is a case to the children. Like vital role is played by the surrounding, society, and parents. And what will be your message to them? Like how to take care of child who is suffering from autism, ma'am? What will be the approach?
See, the society, that means the teachers, the friends, they have to support him. If he is not taking part in the activities, the teachers should make him to take part. They should inspire, they should stimulate them to play the games, to do the activities in the classroom. And when he is not attentive, they should give him some another role. What he जो काम उसे पसंद है, जैसे ड्राइंग करना पसंद होगा, कलरिंग करना पसंद होगा, तो उसको दूसरा उसके बजाय एक्टिविटी देना भी टीचर्स कर सकते हैं. एंड दे शुड मेक द
So
स्टूडेंट्स
society, basically society should be aware
aware
about
of
this diagnosis,
yeah,
and they should help them to become independent.
to become social, to mix with the society. So like that, the
So
teachers role and
that's why it is now nowadays the concept is from special school to integrated school.
Thank you so much, ma'am and sir, for taking the points on this platform. Dr. KK Agarwal, sir, it's a big platform. Our message will be conveyed to all the guardians, audience also who are watching this. I hope that as we know that every child is special, like everybody has their own rights and own ways of living. That all the opportunity should be given to them also. Like they are also the rights of living a good life, right, sir and ma'am?
Yes,
So thank you so
definitely.
much, ma'am, for telling this message to all the audience. Ma'am, moving forward, one message from Dr. Subramaniam is for Dr. Tamboli, sir. Sir, how can we differentiate between autism spectrum disorder, that is ASD, and other development disorder in early childhood? Could you
Yeah.
please say some point?
Yeah. It's very important that what are the other like means differential diagnosis she must be referring. So differential diagnosis can be either ADHD, learning disorder, or it can be mental retardation, or it can be hearing loss, which can be there because ADHD, these autism children also sometimes what happens that they act like deaf. They are not deaf, but they act like deaf. So like like this, you whenever you get confusion about the diagnosis, then what will help you is to give them proper testing. So there are tests like DSM-5 or whatever the test for the ADHD, or whatever the test for LD, or whatever the test for mental retardation, IQ testing or DQ testing. So we have to diagnose them with proper testing, and then treat them accordingly. So differential diagnosis definitely is important, and we have to differentiate them from other diseases, and diagnose them properly.
Thank you so much, sir, for sharing the important points related to that. I hope it will be very much helpful to all the doctors out who is listening out there for the betterment of understanding the patient cases. Moving forward, one more question for ma'am. Ma'am, like it is related, like you are more connected to the social things. You have done lots of program, ma'am. As we have gone through your CV, ma'am, it highlights that you are totally working on the say, social reform of the betterment of the child health care who are handicapped, who are disabled, right, ma'am? So moving forward, it's very important question, ma'am. Like once you visit the different places, ma'am, you see like the person, the child who is suffering from this problem, they are sufferers. Main impact points is related to the ma'am, parents, and they gone through a very mental kind of problem, like his child is not able to do normal as other childs are doing. Lots of things come into their mind. How to deal with this kind of problem, ma'am, for the parents, guardian, ma'am?
So first, see, they are very much frustrated. There is also a psychological pressure. So first, we have to uh, first counsel them, because as it is a matter of patience. Every mother and father has to keep patience for the improvement of the child. It's not a magical progress. So they will need different therapies. They have to keep the patients, and to make their child independent is the first important step. The, and that is it is when it is a important step that is acquired, that is the first success they have got. Means making the child independent, and knowing the child his strengths and his skills. They should identify their skills. आपके बच्चे में क्या पॉजिटिव थिंग्स है, क्या नहीं है, वो पहले जानना चाहिए. And according to that, they can develop, give them hobbies. They can make them to mix in the society and for the better interaction
And
in the society.
nowadays, WHO actually has given us guidelines regarding the not to label the child like DQ of 70 or DQ of 80. Instead of what they tell us, that you have to actually assess the strengths and weaknesses, and act on weaknesses. So give stimulation program for the weaknesses, and that is what is WHO and UNICEF is nowadays coming with. There are some tests which has come for the assessing the strengths and weaknesses, which is called actually the childhood test below 6 years, and that is international standardization has been done of that test. So it is.
And
Hmm.
definitely there is positive result after taking the therapies, occupational this thing, uh, OT and the speech therapy when they take, and when they take the stimulation programs, and we are when we are giving them home plans, and when they are actively engaged in them, then definitely they are the children are giving the better results. And we have found that many of the parents are much satisfied, and they are seeing the progress. Even some of the children's IQ has been improved
Yes,
after the
there are
stimulation programs
many cases. Means there
cases.
are many success stories. Like last week only, one child was having
Borderline
33 IQ 3 years back, and now it has increased up to 72,
70.
which is very magical, and that has not happened in a day, but it requires 3 years.
Yes.
And even one of our child is doing CA. Actually, he got 90% in 10th standard. He is with me since 2002, and we were very happy to him as a successful child. So there are many cases, not this single case or two three cases, but there are more than 50 60 cases which are success stories we can tell you regarding these children, because we are doing this work since last so many years, 33 years I'm practicing. And I think it is very important that we should concentrate on making them independent initially, and then increase their IQ.
Thank you so much, ma'am, and sir, also for answering this question very in an appropriate and a practical manner, and suggesting the and showing cases the expertise on the real time cases, which you have showed that they have shown the positive response. As we have also seen, there is a one movie, sir, Tare Zameen Par. I
Yes.
hope that everyone has watched. It also shows that if your child is different, they have other qualities. We should try to
That
find the qualities that they have.
Sarigamipe is on a learning disorder,
Yeah, it's
but
an
Yes, sir.
actually my name is Khan is
it is autistic.
it
He
has
is
a
autistic.
autism with
Correct, sir.
high IQ. So that is actually different. That is Asperger syndrome. So that has been
Yes.
shown in that movie. So but there is autism in My Name is Khan.
Yeah,
So
so
this,
thank you so much.
they are having many of the positive symptoms also, and good intelligence and different. They have specialities. So we have to identify them. So if we can identify and give support and training programs, definitely they are going to.
And one important factor which we forgot is that pseudo autism. What is
Mm.
pseudo autism is that nowadays there is a media addiction, like mobile addiction is there or media addiction is there. And actually, WHO and UNICEF tell us that you don't give any media or mobile up to 2.5 years. But our setup, we see every nowadays that mother gives mobile even at 6 months of age, and then that mobile has definitely changed their attitude, and they got the symptoms of autism. But if you stop mobile or all these media, then all these symptoms get reversed, which is called as pseudo autism.
Pseudo.
That's why it is called as
Yes,
pseudo
sir.
autism.
Thank you so much once again, sir, for taking out the important concern that is the using of mobile phone using like during the child. Like for example, we say that when baby cries while feeding, like for to stop her from crying, parents give mobile phone. Like they
Which
will
is very
get
very
their
bad
work
habit.
done.
Which is very
Yes,
bad
sir.
habit.
Thank you so much for highlighting this, sir. I hope all the parents out will hearing this and we will work on that for the betterment of the society
So
and healthcare.
up to 2.5 years, no mobile. 2.5 to 5 years, 1 hour in 3 days a week, and
Yes,
after 5 hour, fifth
Yes.
fifth year to 15 year, 1 hour per day. Not only mobile means media, I mean mobile, TV, laptop, whatever is there. So that includes all 1 hour per day, and in Saturday, Sunday, 2 hours. That's all.
yes, sir. Thank you so much, sir, for sharing this routine, sir. I hope it will be implemented to all the parents who are watching this live webinar, sir. One last question, sir. I can see, sir, for Dr. Suchit, sir. Sir, this question is related to that, sir. What are the unique challenges arise in managing autistic adolescent, and how do physicians address them, sir? Can you please suggest some of the
This is
tips, sir?
this is this is very important topic, because adolescent autism is having some problem related to sexual identification. Actually their sexuality is the problem. So we have to train them according to that. So whatever madam was telling, that life skill training. So life skill training, sexuality training, and they're making them independent. All these are very important when we consider adolescent autism. And adolescent autism, we have to manage all these aspects, like life skill training and all these things, because these are important points, and we have to manage these children with that. And parents has to be very cautious about that, and they have to tell them what is to be done, whatever madam has told, about good touch and bad touch and all these things. So they are very important points. So that we have
Uh,
already covered. We
Thank
have
you so
already
much.
covered.
Yeah, thank you so much, sir and ma'am. Like the presentation was really realistic, and the cases are very like to be the practical that you have discussed, both of you. I hope, sir, this will impactful. And once we will join the another session, we will done another webinar with you, sir. We will have a positive response too from the parents, like that childs are getting improvement, and from the doctor, physician too, that who are treating the childs. Your tips, your case study will help them too, sir. Sir, like, can we conclude this session? What will be the take-home message for all the audience for you, sir, from both of you?
Yeah. So the take-home message is very important, that at 1.5 years to 3 years, you have to actually diagnose autism as early as possible. So, if the child is not talking properly, if the child is not understanding the language, then you must actually suspect that child may have this problem, and child is not having eye contact or not mixing with other children. So, all these symptoms which we have referred is very important. So, you have to diagnose the child at early as possible, and the madam will tell you that about early intervention, that what she is giving all the programs.
So your child is definitely going to be improved, but have patience, take all the therapies, take stimulation programs, do the home plans, and see the strengths of your child. Every child is different, and definitely they are going to be independent. And that's my positive words.
Thank you very
Yeah,
much.
thank you so much, sir and ma'am. Like you have created a motivation in between the audience. I hope once this video will be circulated, they are going to help all the audience who are watching this, and will be very much impactful and create a positive impact on the peoples. And as you mentioned, ma'am, like every child has their different strengths. You should do a SWOT analysis of that. Try to understand strength, weakness, and try to work on them. Like with that, with all due respect, sir, I am concluding this webinar for today. And we would like to see you in future also with different topic. Till then, take care of yourself. It was great honor to host you, and thank you so much, ma'am and sir, both of you, for your
Thank
valuable
you very
time.
much.
Right,
Thank
sir.
you for
Thank you.